Diffuse Idiopathic Skeletal Hyperostosis, or DISH, is a condition where the body builds extra bone along the front side of the spine and sometimes on other joints. Think of the spine as a stack of wooden blocks. In DISH, a thin layer of new glue-like bone starts to grow over the blocks, making them stick together. This extra bone is not cancer and usually does not affect the spinal cord, but it can make the spine feel stiff. The exact cause of DISH is unknown. That's why it is called idiopathic. However, researchers have found several risk factors: being over 50 years old, having a lot of body weight, obesity, having diabetes or high insulin levels, and sometimes a family history of the disease. It is more common in men than women. Imagine a garden where extra fertilizer, high insulin, makes some plants grow too quickly. The same idea may apply to bone growth in DISH. People with DISH often notice a feeling of tightness in the back or neck, like trying to bend a rubber band that has become a little stiff. They may have difficulty bending forward, turning their head, or may feel mild pain after long periods of standing or walking. Some may hear a creaking sound when they move, similar to a door hinge that has become rusty. In many cases, there are no obvious symptoms, and the condition is found by accident on an X-ray taken for another reason. Doctors usually start with a simple X-ray of the spine. On the image, you can see flowing ribbons of bone along the front edges of several vertebrae. To confirm DISH, doctors look for at least 4 consecutive vertebrae with these bony bridges, while the joints between vertebrae intervertebral discs stay normal. Treatment focuses on relieving stiffness and pain. Regular gentle stretching like the cat-cow yoga pose, over-the-counter pain relievers such as ibuprofen, and physical therapy programs that teach safe ways to stay flexible. Surgery is rarely needed, only if the extra bone compresses the airway or causes severe nerve problems. Because the exact cause is not clear, prevention is about managing the known risk factors. Keeping a healthy weight through balanced meals and regular walks can lower insulin spikes that might promote extra bone growth. Regular exercise that includes stretching and strengthening of the back and neck helps keep the spine mobile, much like oiling a hinge keeps it from rust. Controlling blood sugar, if you have diabetes, also appears to reduce the chance of developing DISH. Recent studies, 2022 to 2024, have used CT scan 3D modeling to better understand how the extra bone develops over time. One small trial showed that a low-dose vitamin D supplement, combined with a diet low in sugary drinks, slowed the growth of new bone in a handful of patients, but larger studies are still needed. Another research focus is on a molecule called BMP2 that tells bone cells to grow. Scientists are exploring drugs that could block this signal,